2. Pyelonephritis. Pyelonephritis is an inflammation of the kidney pelvis and the kidney tissue. Pyelonephritis can be either acute or chronic. Acute pyelonephritis. Let's start with acute pyelonephritis, a fairly common form of this condition that, if treated promptly, can prevent extensive kidney damage. 1. Etiology of acute pyelonephritis. The primary cause of acute pyelonephritis is a bacterial infection. Bacteria typically reach the kidney by ascending from an infection in the lower urinary tract. This can happen in various ways, including 1. Congenital weakness at the junction of the bladder and the ureters. 2. After urinary tract instrumentation, such as catheterization, cystoscopy, or urologic surgery. 3. From systemic infections like septicemia, where bacteria are carried to the kidney by the bloodstream. 4. When a patient cannot fully empty the bladder due to factors like tumors, strictures, or benign hypertrophy, creating an environment conducive to bacterial growth. 2. Incidence of acute pyelonephritis. The incidence of acute pyelonephritis is higher in specific groups. Pregnant women, as a small percentage, develop bacteriaria bacteria in urine, which can progress to pyelonephritis if left untreated. Sexually active women who face an increased risk of bacterial contamination. Diabetic individuals with neurogenic bladders where incomplete bladder emptying can lead to bacterial growth. Individuals with other renal diseases whose impaired renal function increases the risk of pyelonephritis development. Signs and symptoms of acute pyelonephritis. The signs and symptoms of acute pyelonephritis may vary, but can include 1. Urgency, frequency, and burning during urination. 2. Urine with a fishy odor and cloudy appearance. 3. Back and flank pain over one or both kidneys, often due to edema. 4. Chills, fever of 102 degrees Fahrenheit or higher, nausea, and vomiting. 5. Possible abdominal rigidity. 6. Presence of protein and casts in urinalysis. Treatment of acute pyelonephritis. The primary approach to treating acute pyelonephritis involves antibiotic therapy. Here's what you need to know. Antibiotics should be administered after urinalysis and culture and sensitivity tests have been performed. Continue antibiotics for 10 to 14 days, even if urine becomes sterile within 48 to 72 hours. Encourage a fluid intake of more than 2,000 ml per day, but advise patients not to overconsume fluids to maintain antibiotic effectiveness. Fever can be managed with antipyretics, which are medications that reduce or relieve. Emphasize the importance of rest and educate patients with a history of urinary tract infections on recognizing early signs of infection for prompt treatment. Chronic pyelonephritis. Now let's shift our focus to chronic pyelonephritis, a persistent infection that can scar the kidneys and potentially lead to chronic renal failure. Chronic pyelonephritis is often associated with urinary tract blockage, and repeated bacterial infections can trigger its development. However, this disease can be effectively managed with antimicrobial medication. Prevention is key and involves avoiding catheterization and instrumentation and practicing good hygiene.